I've given you access, doctor.
Yes. Yeah.
Okay, great. So,
Great. Can I start then?
yes, we can start this.
Okay, awesome. Thank you so much.
Yes, good evening, doctor. How are
Yeah.
you?
Hi. Good evening. All good, all good.
I should first apologize because this was scheduled last month and we are all
It's
eagerly
okay.
waiting for such a
It's
lovely festival.
okay.
And now, finally, thankfully, I'm able to fix it today.
It's okay. It's okay.
A
It's
big
okay.
pleasure, and it is a big honor for me to introduce someone who is, learned MBBS and now completely converted to homeopathy, and has always had an interest. That's a different issue, but wanted to learn, the proper diagnosis, examination, and coming back to homeopathy is, it is a pleasure to see so many people are now wanting to follow homeopathy as a you know practice of medicine is giving immense pleasure for everyone, all the homeopaths here.
Yeah, definitely.
I
Thank you
think with
so much.
that, I think with that small short introduction, we can start because I don't want to take much of your time.
Sure, sure, sure. We are already like
Yes,
7 minutes late.
yes.
Okay, so
I'll go off.
sure,
We can audio. You can start. I've given you access for the presentation. You can share
sure,
your.
sure, sure. All right, okay. Thank you so much, and lovely to see so many people joining in today. So the reason I chose this topic because it's really close to my heart. I started working in obstetrics very closely when I got pregnant, and then my pregnancy was homeopathy support, my labor was homeopathic support, my postpartum was definitely homeopathic support, and then post my like baby, when I started the practice again, I started seeing a lot of pregnant women in my practice because I did a course in childbirth education. So I teach parents about healthy practices in birth and what to expect in pregnancy, how to manage labor, and those kind of things. So I started seeing small cases. I started, I use them not just in pregnancy, but also in labor, like for induction, for augmenting labor, and also postpartum for different issues. So slowly, I'm building it up. I am quite new to the whole thing. So I passed out in 2011. And since then, I've been a homeopath and GP, and in only since the last 3 years, I'm actively into obstetrics using homeopathy. So through my journey, I have met doctors who are MD obs gynac, and they are practicing homeopathy for their clients, like for infertility and for other pregnancy issues. It was amazing talking to that doctor. Also met a lot of midwives who are using homeopathy actively in their practice. So I think the trend is changing a lot, and I also feel and I also hope that one day the homeopathic department would make obstetrics as one of the subjects, because I think that specialty should be introduced. So that is my whole idea, that eventually it happens. So without wasting much time, I think I'll quickly start my presentation. I hope I'm clear, audible, Rashmika.
Yes, doctor. You're very much clear and
Okay,
audible.
just
Yeah,
1 second.
yeah.
Yeah, okay. So I'm just sharing my presentation. So one of the challenges for treating, or you can say for managing pregnancy and labor, is to understand when to prescribe. Not all cases require a prescription. A lot of the times, just simply managing it physiologically, or managing it with some exercises and yoga, that itself would do the trick. So the idea is to understand. So this is the presentation that I'm going to make, is how do you select how to treat cases, and if you have to treat them, how do you treat them? That's the idea of the presentation today. So the first thing is identify the cause of the problem in pregnancy. Now, depending on the trimester, whether the mother is in first trimester, second trimester, or third trimester, the issues are varying, and the issues are kind of fixed. So in the first and early second trimester, you're going to see a lot of morning sickness, nausea, vomiting, acidity, headaches, weakness. This is quite common. In the second trimester, you're going to get things like difficulty in breathing, or swelling of feet, gestational diabetes, hypertension, and so on and so forth, anemia. So these start cropping up in the second and the early third trimester. And towards the end of the third trimester, we are going to be dealing with things like delayed, like labor not starting, malposition of the baby, labor being too painful, labor being associated with other issues like bleeding, and these are the things that we see in the last trimester. So a lot of the things are physiologically present in pregnancy. So first is to understand what it is. So what are the causes? The first cause is hormonal. We are going to see in the next slide how hormones are going to affect certain issues in pregnancy. So first definitely is hormone, because of the rise in progesterone, estrogen, HCG. So some of the physiological changes that happen, which causes the symptoms. Second thing is postural. This is very, very important. I've had moms who come to me with pubic bone pain, especially in the second and the third trimester, when the belly also expands quite a bit and the pelvic inlet is also expanding. So the pubic symphysis, which is there, it sort of separates. So they get a lot of pain over there with respect to that. So, and I realized rather than treating them on medications like on homeopathy, there are a lot of medicines. You can give Ruta, you can give Bryonia, depending on what relieves the pain and what makes the pain worse. You can give Rust dogs. But I realized more efficient than giving medicine is to just give them certain exercises which help them take the weight off the pubic bone, and that relieves the pain tremendously. Like in a week's time, they say the pain is completely gone. So posture, very, very important, whether they're maintaining the right posture, because a lot of the time when the mom is sitting, especially now if they're working 8 to 10 hours a day, they're going to be constantly in the sitting position, and the pelvis kind of, tilts inward. Because of that, a lot of back pain happens, a lot of pubic bone pain happens, tailbone pain happens. So understanding that and giving the remedial measures, that works. Next is physiological. So hormonal and physiological are kind of interlinked. We will see this in the upcoming slides. Pathological. Now, this is something that we need to address. Like, for example, if there is morning sickness, which is quite severe, debilitating, the mother is vomiting 5 to 10 times in a day, unable to eat anything, can't bear the smell of anything, cannot cook, is completely paralyzed work-wise. So these are the things that are pathological, then they have to be corrected and they have to be addressed the right way to get optimal results. Next is mechanical obstruction. So because pregnancy is like a thing growing inside the body, because of the size, there can be a lot of obstructions either upward, like towards the stomach. There can be obstruction towards the chest. There can be constipation because of that. So identifying if there is something like this and correct that, so that you can correct posturally, giving mom certain tips to relieve the constipation. So these kind of things help. And lastly, what are the obstacles to cure? And if there are any, which are quite a bit and which is very interesting. So I had a case of severe acidity, nausea, not vomiting, but there was a lot of acidity and nausea, and it was going way into the second trimester. So the mother was almost 20 weeks when she came to me and she said, I'm tired of this acidity, I'm tired of this nausea, all these things. And I said, okay. And I took her case, got the totality. I gave her Sorinum as a remedy. So I gave her 30 and just one dose, and she was perfectly fine in 2 days. And then again, after like 2 weeks, she said it's kind of coming back. And I gave her Sorinum 30. I repeated the dose. It again went back, it went off in a day and again came back after 15 days. So I was trying to understand, yeah, what is happening? So I asked her, what are you taking? What are the other things you're taking? She said, nothing much. I'm taking iron supplements. I'm taking B12 supplements and folic acid supplements. Other than that, I'm not taking anything. So I said, okay. Then I asked her to send me the prescription of, the what brand is she taking and what are the ingredients of that. So I realized that in the B12 supplement, there was a orange color that was added as the additive, because it was a normal brand, it was not an organic brand or something like that. I said okay. So I said, you know what, I think maybe the supplements are not suiting you. So I shifted her from the regular supplements to a organic supplement which did not have color, which did not have additives, and which did not have fillers. And believe me, in a week's time, in fact not even a week, the day she stopped those supplements, her acidity went off. I didn't even repeat the dose of the remedy at that time. I said, I just want you to check. And she said, oh my god, it's gone. And then after that, when she was on the B12 which I prescribed, the acidity never came back. So these are the obstacles to cure which you need to pick. So where you're very sure that your remedy is actually correct, but it's still not working. So either work with the potency, or work or look into what are the obstacles that you might find which is causing the problem. So this is very, very important. So as I told you that the hormonal interplay in pregnancy is very important, because they are the reason why we have most of the symptoms that come up. So here, as you can see in the, yeah, so in the first trimester, most of the hormonal changes happen in the first trimester. So we see a lot of nausea, morning sickness, fatigue, irritability, emotional, upheavals. This is all happening in the first trimester, and which kind of, goes down by 12 weeks or so. So you can see that the progesterone is rising and it stabilizes after 13 weeks. The estrogen rising also stabilizes after 13 weeks. The HCG, which rises and then drops and then kind of drops towards the end. And then you have HPL, which also goes up and starts stabilizing after 13 to 14 weeks. So everything usually within 12 to 14 weeks they resolve. So even if a mother comes to me for nausea, which is not very severe, and she's able to manage, I tell her, you know what, just wait until 13 weeks, 13 or 14 weeks. And if you're better by then you don't even need a medicine. So I try to manage the nausea by doing diet changes, because what I feel is, what I have seen also, that if the mother is eating less of junk food, more of home cooked food, selectively avoiding the food that triggers her nausea, it's quite fine till 12 or 13 weeks. It doesn't, trigger much. And in those severe cases where there is a lot of vomiting, where there is a lot of nausea, where there's absolutely nothing the mother can eat, then those are the cases that I would choose to treat. The rest, I'm going to just wait till 13 to 14 weeks and see, you know what, you're going to wait and we'll see what happens. That's what I choose to do. So what are the physiological changes that happen, and should they be treated? So that's the next question. So the first thing is the total lung capacity decreases and the respiratory volume decreases. So because of all of this, the mother starts feeling a little breathless, and she might have to breathe a little faster than she normally does, which is completely normal. So you need to tell her to do activities which are not very fast paced, tell her to slow down a little bit, take rest. See, that's the thing. We think that we are super women and we can do everything in pregnancy. Yes, you can do everything in pregnancy, but you also have to accept the fact that this is a huge physiological burden and change in your body. So there might be things that, you might have to do differently. So counseling the mom on that helps. Development of mammary glands. So slight bit of tingling, pricking sensation, sometimes even milk discharge might be there for mothers as early as 5 months or 4 months. These are all completely normal and they need not be treated. There is an increase in cardiac output, there's increase in blood volume, and there is tachycardia. So there'll be no palpitations. Sometimes the heart rate can be as high as 90, which is also completely normal. So these are the things that sometimes freak out women. They call me and say, I checked my heart rate today, it is almost 90. And it's like, it's normal because your blood volume is increasing. So you are going to have a little bit of tachycardia. That is not something that you need to treat. Decrease in BP. This also happens for a lot of women where the BP goes down to 100 by 70, 110 by 60. And definitely it might be a little, irritating for the woman because she might have postural vertigo and things like that. But making them understand that it's normal, it's a physiological reaction of the body, and just ask them to keep drinking plenty fluids and take rest as much as possible and not to do sudden movements. So these are the things which will help them. reduced gastrointestinal motility and decreased tone of the lower esophageal sphincter. Very, very important. And this is the cause of most of heartburns, most of the indigestion, gases, this, what do you call that? GERD, reflux. So all that thing happens because of this, which happens due to the progesterone. So one of the ways to reduce this is ask them to have smaller meals, ask them to space out the meals through the day every 2 hours or every 1.5 hours, depending on how hungry they are. And trying to avoid extremely fatty food, extremely oily food, extremely rich food, and not to have anything heavy post 7 p.m. in the night. So just giving them a circadian rhythm, like giving them a rhythm to eat and how to eat, this symptom can be easily controlled. You don't have to give medication for, acidity, heartburns most of the times. Next, obviously in the third trimester, we see incontinence. There is an increased load in the kidneys because of increased blood volume. And incontinence can also happen a little bit in the first trimester and a lot in the third trimester. Need not treat it really. You can just wait and watch. Usually post delivery, these things get corrected on their own. If it doesn't get corrected, then obviously exercise, strengthening the pelvic floor muscles, physiotherapy, yoga, they should be looked at first. And then you can give them other remedies as per indicated. Alteration of collagen metabolism. So this is very, very important in pregnancy because this is what makes the pelvis loose, supple, and expandable during the birth process. So this is very much needed. But at the same time, because of this, as I said, pain comes, like the pubic bone pain, sometimes tailbone pain. So when this comes up, yes, I think in these situations, some remedies are required. But as I said, yoga definitely helps. So if your mom is not physically active, counsel them to do that first rather than directly treating with medicine. So tell them like, no, you need to do yoga and you need that so that you can strengthen your joints and ligaments. Nerve compressions. So we see cases of sciatica during pregnancy, which can be very well treated with homeopathy as well as physiotherapy and exercise. You also see something called as carpal tunnel syndrome because of nerve compression in the wrist, which also commonly happens. Again, homeopathy works beautifully for nerve compressions. So this is something I would definitely treat because it's very painful. Increasing water retention, so swelling. So if the swelling is mild on both feet, then I would just suggest elevating the legs, doing leg raises, some exercises, and then see how things are. Like there was a mother who had told me that exercises are helping her, but her fingers are getting swollen. So I told her, why don't you try massaging your fingers and dry brushing your fingers, so lymphatic massage. And after 2 days, she told me that her swelling is much better. So sometimes just something as simple as this will fix the problem. So don't hurry up to give medications, basically. And obviously there is reduced smooth muscle tone, which can lead to constipation. Constipation can also be because of the position of the baby and compression of the intestines because of the baby. And there is uterine relaxation. So this uterine relaxation can also mean that the labor is not starting on time, which we'll see later on, but that might also happen. So these are the physiological changes that we see in pregnancy, and keep this in mind when you're treating anybody. So ask yourself this question, like, is this physiologically right? What is happening? Is this part of the normal picture? And if the answer is yes, then try to see if you can fix it first without the medicines, and then if it's severe or it persists or it's troubling the mother, then you give remedies for it. So let's coming down to homeopathic prescription. So there are different ways that you approach a case in pregnancy, as with any other, problem. So first is obviously acute prescription. So you will have in this, I think you will have sore throat, tonsillitis, cough, fever, all these things which happen during pregnancy, which can also happen otherwise. So in those cases, definitely acute prescription is the way to go. Pregnancy is just a thing. It need not be considered in the totality, which is what I feel. Then there is generic prescription. Generic prescription is something about tissue salts, which I'll come to later. and prescriptions which can be given just on the basis of diagnosis or just on the basis of symptoms. Like you don't have to have a totality for it. Sometimes that are needed, like ruta, arnica. So these are some of the examples, calendula, then obviously tissue salts, which I will talk about later in the presentation. So these are the generic prescription. Then you have constitutional prescription, which obviously most of the cases would require. And then you have a physiological prescription, which is what I was saying. So exercises, diet changes, yoga, etc., etc. So understanding what prescription the mother will fit in best is very, very important. So I'm going to start with just one example today because we don't have a lot of time for discussing long cases. So this is an example of morning sickness which I've taken. So this is compass repertory which I use, and I just put in the term nausea and pregnancy, and you can see that there are 63 remedies coming up and 78 remedies coming up for vomiting during pregnancy, right? So I don't understand when people directly say, oh, nausea in pregnancy, give ipecac, or vomiting in pregnancy, give ipecac, nausea in pregnancy, give lycopodium, give nux vomica. So I don't understand how that works because it cannot work. Even when you see the repertory, the rubric itself is so big and you have to choose. And sometimes there are remedies which don't even fit in the repertory. Like I'll tell you, I had a little bit of nausea and couple of episodes of vomiting when I was, I think, around 8 weeks or so. And it was a little frustrating because the nausea was very, 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 very constant. And obviously me being a homeopath at that time, I wanted to, get rid of it. So I just took a totality of my everything. One of my friends helped me with it because, you can't take your own case. And she prescribed me graphitis. And it worked wonderfully. I just needed one dose. My vomiting never came back. My nausea never came back. And you can see that graphitis is not even in the rubric. If you see, yeah, so in this nausea pregnancy, there is no graphitis. Even in vomiting pregnancy, there is no graphitis. And the reason she could prescribe graphitis because she took the whole case and she, understood my mentals and everything, and then she prescribed graphitis. So it is important, very, very important, to sit down and talk to the mother at least for 10 minutes, understand from where she's coming from, why she's suffering, what are the other issues that she's had in the past, and that will help you narrow down the remedy pretty early, right? Now, just giving you an example. So if you take the definition of morning sickness, so it is basically including nausea and vomiting, which is triggered by certain odors, spicy food, triggered by heat, also sun. Another symptom which I have not written here, which I get very frequently, is from the tadka or in the kitchen. So in the kitchen, when something is getting cooked, that odor they are not able to stand. And there is excess salivation, and often at times there is no trigger at all. It just comes and goes whenever it pleases. So if this is the definition of the problem itself, then these symptoms you cannot give so much weightage when you are defining the totality. If you do that, then you will get all the standard remedies. You will get sepia, you will get natramur, you will get ipecac, you will get all those remedies, iris. So all those things you will get. So what you need to look for when you are seeing a case? So look for peculiar symptoms. Like for example, cold water is ameliorating my nausea. There was somebody who said, if I have just 2-3 spoons of sugar, I am completely fine. So these are the kind of peculiar symptoms that you need to look for. And then definitely mind symptoms. I'm sorry, somebody raised their hand. Did somebody raise their hand? Okay.
No, no, no. You can continue.
Okay.
It would be
All
better.
right.
If anyone has any questions, please type it in the chat box below so that it doesn't interrupt the session. Yeah, thank you.
Yeah, I'll get to the questions later.
Yes,
Don't
yes,
worry. Yeah,
definitely.
awesome. So the next thing important is mind symptoms. So how the mother is, generally what's her nature, and also you need to ask for the nature before pregnancy and nature in pregnancy. So it changes quite a bit. So recently, very, very recently, I had a mom for severe morning sickness, nausea, vomiting, and the husband, and she also told me that post her conception, she has become very, very emotional. Like she was not like that before. So she cries for literally everything. She even started crying in the clinic while talking about her, problem. And so on the basis of her symptoms, I gave her Pulsatilla. One dose worked beautifully, 200, just one dose. And when the next day her, nausea was better, there was no vomiting, and she did not even, she, didn't feel the need to take other medications. So mind symptoms, definitely take. Please do not miss that. Physical genitals, very, very important because they change quite a bit in pregnancy. So a mom who was cold before thermally might feel cold, might not feel cold when she is pregnant. So she might be hot. Then sweating, then her constipation, how is her bowel movement. So all these things you need to ask for. Thermals, as I just said, and appetite and thirst. So try to gauge all these things, and I probe a lot into mind symptoms because I feel that from generals and thermals and physical symptoms I don't get much when it comes to nausea and vomiting. It's always like, ha, isse bhi hota hai, this also happens, that also happens, this also triggers, that also triggers, and sometimes they don't answer me correctly. So I get a better picture with the mind symptoms. So I look for that. Or peculiar symptom, if something is popping up, then great, then that will be the symptom, like the PQRS symptom that you can keep and give the remedy. So think in that direction. So as I was mentioning earlier, tissue salts I use a lot in pregnancy because I feel they are very, very safe, and you are not triggering the vital force as much as a 30 potency or a 200 potency would trigger. It's a very superficial reaction, and it helps balance the physiological imbalance very beautifully. So it is a very safe microdosing that I say, and they have the actual mineral component. Like I don't know if the doctors in the presentation today are using it, but I do use it a lot for supplementing iron. So I use ferrum for 6x and 3x for upping the hemoglobin of a woman or of anybody. I use Calcarea for 6x, 3x, especially children for calcium deficiency. So the actual minerals are present, but it's microdosing. So it is not going, like it will not have the side effects that a supplement might have, but it will also do the work. So you can use 3x, 6x, 9x, 12x, depending on how severe the deficiency is. Like you can use zinc for restless legs. You can use MagPhos, magnesium phosphoricum 6x. I use that quite a bit for gas related issues or any sort of crampy pain, especially in the calves. Then crampy pain in the abdomen, crampy pain in the chest. So all these things, MagPhos 6x works wonderfully for me. So I use that quite a bit. Then I have a fixed regimen I use and a flexible regimen. So what is the fixed regimen is basically every month of the pregnancy, the fetus is undergoing certain changes. So in 1 month, the bones are forming. In the next month, the nails and the hair and the teeth are forming. Sorry, not teeth, sorry. Hair and nails are forming. So depending on which developmentally where the baby is each month, there is a combination of tissue salts which can be used, which helps the process. So in between you will have natrimur for water retention and for BP related issues. Then you will have silica, which comes up when the hair and nail formation takes place, and also silica comes up somewhere around the 7th month. Then there is ferrum phos, obviously, which comes up 2-3 months in between in the second trimester, because that's where the iron deficiency anemia happens quite a bit. And then of course, Calcarea Fluor 6x, which I maintain almost throughout the pregnancy because it helps with the soft tissue elasticity, helps with the ligament pain, and also helps in postpartum recovery. So I like to give this regimen to women who are ready to take it. So I give a monthly regimen and they respond quite well to it. I myself took it when I was pregnant and it helped me quite a bit. And the flexible regimen is basically where you decide what tissue salt you want to give depending on what the symptom is. Like I said, if the mother is iron deficient, then you can give ferrum for 6x along with whatever iron supplement she's taking. And sometimes they don't even need iron supplements, just ferrum for 6x will do the job. Then you can give MAC for 6x for magnesium. You can give zinc X potency for zinc deficiency. So like that, you can make a flexible regimen for any mother that comes to you. Obviously, the plus point is you need not wait for a constitutional remedy to arrive, and definitely tissue salts do their job on a physiological level, on a superficial level. So definitely keep this in mind. So next we come to the $1 million question of scope of homeopathy in labor. In fact, yesterday only somebody had messaged and asked me, so can homeopathy induce labor? Yes or no? So what is normal labor? First is to understand what is normal labor, and then to understand if it has been deviated from normalcy, and if it has, then what has to be corrected. So these things need to be understood when you're giving homeopathy in labor. And obviously the best way to use homeopathy in labor is to be in the labor ward with the mom. I know that is kind of difficult. So I have personally done it only for one mom and myself, of course. And for the other moms, I have been there telephonically present for them. But the other dog, like I told you, I have few friends who are midwives who are using homeopathy. So they actively use it when the mom is in labor. They are right there. They have a kit with them and they use it, one after the other, whatever is required. So it's amazing to hear some stories like that and some cases like that. Very, very amazing. So the normal birth is defined as spontaneous onset, which is low risk at the start of the labor and remaining so throughout labor and delivery. And the contraction that starts, it leads to dilation of the cervix and descent of the baby and spontaneous ejection of the baby. That is the birth of the baby. So if this happens in sequence, then yes, it's natural labor or normal labor. Sometimes the sequence doesn't happen this way. Like for example, the mother might be experiencing lot of pain, lot of unsynchronized contractions which lead to pain, but the cervix is thin, thick, and absolutely not open. So then that is a abnormal labor and that should be treated, right? So these are the things that you need to check for. So if a mother is coming to you with certain labor related complaints, you need to ask them what has the gynecologist found. Like, is the cervix open? Is the cervix thick? Is the cervix thinned out? What is happening? Have you released the mucus plug? Has the water broken? So these are the questions that you need to ask the mom before you decide whether you want to give a homeopathy medicine or not. So will homeopathy induce natural labor or the labor process? If the woman's body is not ready, then absolutely no. Okay, so if in 36 weeks or 37 weeks, a mom comes to you saying that you give me medicine to induce labor, whatever you give, the labor is not going to start because the mother's body is not ready. So I had a mom who was 41 weeks. So she was 1 week past her due date. And she called me from, I think, yeah, she was in Vashi. Based in Pune. She called me from Vashi and she said, I'm 41 weeks already and the doctor is like pressurizing me to get induced. I don't want to get induced. Can you suggest some homeopathy? I said, okay, we'll try. But in my head, what I thought was she was already past her due date and almost a week past her due date. So maybe her body is kind of ready. So I gave her Simicifuga caulophilum alternate and her labor kicked off in 2 hours. Like I had given her 1 hour alternate to take both of them. In 2 hours, her labor started. Like she started getting contractions. And it took maybe 24 hours for the labor to establish. And then after 1 day, so after 24 hours, she got admitted to the hospital and they checked it. She was 5 centimeters dilated. So then that kicked off the labor process. But it happened because she was ready, the baby was ready to come out. Had I done this for a mom who was 37 weeks pregnant, it might not have worked. So you need to understand that aspect also, if the woman's body is ready or not. And if the woman's body is ready, then you can make abnormal labor as naturally as possible, right? Like I said, if she's having asynchronous contractions, the cervix is not expanding as much, and so the remedy will help correct that. Another thing where homeopathy beautifully helps is back labor. A lot of the times women have pain in the back, lower back, in the sacral area because of the way the baby is positioned and the baby is trying to turn. And in those cases, the back pain is excruciating. Kali Kab is a wonderful remedy that works that time. Wonderful. Close your eyes and give Kali Kab. Works wonderfully. Then cramps during labor, especially in the legs. So you can give either Macphos or you can give Colosins, depending on how the cramps are. Definitely works. Carbo veg is again a wonderful first aid remedy to have in labor when the mother is exhausted, completely drained out of energy, and carbo veg will like instantly, give her that energy to get back into labor. So these are some remedies which you should have in your labor kit, and that definitely help. Remedies will not change the bony structure. So if there is something that is, interfering in the process, like the pelvis is small, or the pelvic, there are two protrusions inside the pelvis, they are kind of obstructing the baby's way out. So these are the things that homeopathy might not help a lot. But what it will help is it will help the soft tissues, go normal. So I had a mom who had like her belly was always tight, like very, 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 very tight. I don't know how. Her belly was always tight. And depending on her symptoms and depending on how she was at that time, I gave her a dose of China, and just one dose. I just wanted to see. But then that beautifully helped the belly relax, belly loosen up, And the mother was also quite surprised. She's like, oh my God, this happened, because her belly was always tight. So some things like that, homeopathy can help change. It will relieve suffering and produce normal uterine contractions. And obviously, this everybody knows that it will improve the vital force, and it will, give the mother also a new zest of energy to, go with the process. So how do you prescribe in labor? Now, this is again, it's a controversial topic in the sense that there is not a lot of literature on it. I tried to take out papers. I tried to gather material on this when I was learning also, but there is not a lot of material, unfortunately. So that is the reason I had to contact birth centers in Germany, birth centers in Ireland, where the midwives were using homeopathy, and I, spoke to them. I asked them, okay, what are the remedies you're using? What are the indications? How are the results? So this is how I got my information from. There's another doctor in Maharashtra who is a gynac who practices homeopathy. I asked him also, so what are the remedies you're using? What helps you? So he also told me about Kali Kab, which works wonderfully in back labor. So yeah. So first thing is frequent repetition. So if you know the remedy is correct and the remedy is working, sometimes you need frequent repetitions. Like for this mom, for induction, I gave Simesi Colophilum alternate every 1 hour. So frequent repetitions help. Water dosing definitely helps. So you just put the remedy in a glass of water, keep it next to the mom, give it to the husband or the whoever is with the mom, and then they can give one spoon every 1 hour or every 2 hours, depending on the dosage you fix. Remedy changes happen quite a bit. So in my labor, I remember initially I had Kalika because I had severe back labor. And then in between, I had to have a dose of carbo because I almost fainted. And then there was a dose of cupromet which was given because I had very, very severe cramps in my legs because of the position that I was in. So 3 remedies changed in a matter of 4 hours. So sometimes frequent remedy changes are required in labor. So this is why I said, if you have a chance to work in the labor ward, be next to the mother, give her the remedies as and when, the indications come up. That is the best way that you can, get experience about this. Obviously, labor should be considered as an acute more than a constitutional thing. Obviously, you won't have time to get a lot of mentals. If the mentals are jumping up to you, then great. Like the anxiety of the mother or the fear of the mother. Like there was a mom who said that I was very scared that I might die or the child might die. So these are the kind of fears that might come up. So in those cases, giving her a dose of aconite to calm down, that itself will do a big, help to the mom. So understanding what state of mind she is in and what other things are coming up, jumping to you, you give the remedy based on that. Definitely use higher potencies, 200 or 1M. 200 is pretty safe. I use maximally 200. I don't think I've ever used 1M in labor. But I think 200 and up needs to be used. And remedy kit, this is something also I encourage you to do with your mom. So if you have a mom that has been following you through her pregnancy or even through the conception, then you can give her a kit of say 15 to 20 remedies which she can have with her, and then she can consult you on the phone, or the husband can call you and consult you as and when problems come up. So this is something that you can think of. uh, for an example of what remedies you can put in that, Helios in UK have a very nice pregnancy kit that they've already made. So go to their website, check out the remedies that they have used. So they have very common remedies, like Kali Kav is there, Aconite is there, Arnica is there, Bellis perinus is there. So these are the frequent, Semicifuga, Colophyllum, Cuprum Met, Macphos. So these are the remedies which are there in the kit. So you can give a kit for commonly used remedies, and then it can be with the mother, and she can use it in the hospital. Even if you are not with her, she can consult you on the phone and she can use the remedies in the hospital. So this is a good way to prescribe in labor. Now in postpartum period also, homeopathy definitely helps quite a bit. uh, Soft tissue strengthening. So giving a dose of arnica or Bellis perinus or ruta, depending on what symptoms come up. So like, for example, if the mother says that my uterus is feeling very sore and everything is fine, I just feel sore in my uterus. So in those cases, I find Bellis perinus works very well. So that can be given. So depending on what sort of complaints the mother comes up with, you can decide what you need to give. Excessive abnormal bleeding in the postpartum, definitely. I had a little bit of bleeding after the placenta came out, and one dose of ferrum it helped me tremendously in controlling the bleeding. So sometimes even pathological hemorrhages can be worked. Sometimes no, a lot of the times. I'm sure all the homeopaths know this. Healing of the stitches, episiotomy stitches or cesarean stitches, whatever it is, and definitely a dose of calendula or application cream of calendula also might help. Then post C-section complications like headache because of the epidural and the anesthesia which they gave, when the cerebrospinal fluid leaks sometimes, it causes severe headache for moms. So that headache, vomiting, pain, infection of the wound. Sometimes there is hypogranulation tissue which comes up in the stitches. So these are the things which can definitely be corrected using homeopathy. Breastfeeding, I have purposely put a question mark over there because in my experience and in my observation, most of the breastfeeding problems happen because of lack of proper support and lack of proper understanding of what breastfeeding is. That itself is a huge, topic in itself. I'm not going into detail, but refrain from giving remedies to increase breast milk and things like that. What you can treat is, you can treat if there is pain in the nipple, there is candidiasis of the nipple, there is mastitis, or there is abscess, breast abscess which needs to be drained. So these are the things that you can definitely address with homeopathy, and they work wonderfully. I had one mom who came to me 3 months, no, 5 months postpartum, and she had a history of breast abscess which was excised, like which was drained out by surgery. But she said that the pain never went. So that breast abscess, the pain in that area of breast abscess was always there, and she was finding it very hard to breastfeed her baby, and she had almost stopped breastfeeding her baby because of that pain. So she said, I went to the doctor, the surgeon. He said, no, it's nothing. It's just that, the remaining wound or the remaining sensitivity which is there, it will go off. That is what the surgeon said. So she came to me. I took her history. everything. I prescribed her a dose of alumina, 200, and just one dose. No, I gave her two doses. I think I gave her two doses, and her breast pain disappeared after that. So, I mean, I was also quite amazed at how fast it worked. But in a week's time, she said that her pain was completely fine. Like she has absolutely no pain, and I followed her over the next 6 months. Also, the pain never recurred. So these are some of the things definitely which homeopathy can be used to manage. Right. Okay. Thank you. I think there was a long presentation.
No, no, no. It is a wonderful webinar. Actually, sharing your experiences. A person grows with experiences, especially if the person is seeing the experience or actually, going through the experience. So, I think sharing your experiences would go take longer way. It takes
Yeah,
you as well as when you're sharing your knowledge. We have few
definitely.
questions. We have a few questions. We'll cut right into the questions.
Hmm.
Mm, can you share fixed regime of your of tissue salts?
Yeah, okay, I can do that. It's a long table, so I had kept it for the later presentations, but
Yes,
maybe I can share it with you, Rashmika, and you can maybe post
yes,
it or you can
definitely,
send it to them. Sure,
definitely.
I can do
We
that.
shall announce the sessions also while finishing the webinar. Does all homeopathic medicines act properly if the patients are on some antibiotics, especially postpartum?
Definitely. And also, there is a general well being. So, even if they're on antibiotics, they are taking even other medications, not just antibiotics, they're on thyroid medication, they're on BP, whatever. When the right remedy is given, there is a general well being that the mother presents with. That is what is more important for us. And definitely, whatever medication she's on, maybe the symptoms might be a little obscured because of the layer which is formed by the antibiotics, so that you need to probe a little deeper to get a better totality at that time. Yeah.
Another question: do you ever use the combination bioplasma, cell salts, or only single for pregnancy?
I use combinations, but I give them single combinations. Like for example, I'll tell them take Calcarea fluor 6x, Natramure 6x, and Silicia 6x, for example. So I tell them you get them separately and you take them, or I prescribe them, I dispense it to them separately, and I ask them to take it that.
Okay. Manisha has asked, can homeopathic medicine cause abortion?
Uh,
No.
no, I don't think so. Absolutely not. Because as I said, if the body is not ready, then the labor also will not start. And if homeopathy medicines could cause abortion, then we could actually give homeopathy as a form of contraception, right? But we don't do
Exactly.
that.
Yeah, very true.
So don't, because no, this is a very good question, because I was also afraid a lot of times to use remedies like pulsatilla in
Yeah.
pregnancy. And as
Yes.
I told you recently, I had a case of morning sickness and I used pulsatilla and it worked wonderfully because it fit the totality at that time.
True.
Yeah.
Lovely. Any other questions? Anything? Any other questions?
No, I think that's it. Somebody asked me zinc in tissue form. Yeah, zinc
Any ex-
met 3x
Sorry, I
you
missed.
can use in tissue form. So the symptoms of zinc deficiency are, as I said, restless legs, which happen sometimes in pregnancy. Generally, also it happens in zinc deficiency. So if there is a lot of calf pain, restless legs, unable to sleep at night because of that, then you can think of giving zinc met 6x. Experience in IUGR? No, I personally don't have an experience in IUGR. But from what I gather about IUGR and what I have seen so far, IUGR, it's a very, what do you say? I think the diagnosis is sometimes wrongly made by the doctors. So you need to understand if firstly it is diagnosed correctly, and if it is diagnosed correctly, and just by improving the nutritional status of the mother or giving some supplements to her, the IUGR can be taken care of. If that is not working, then definitely I think totality will help. So giving a constitutional remedy at that time will help. But again, you don't have a lot of time, because if it is IUGR, then by 36 weeks, usually the labor is induced and the baby is delivered. So you don't have a lot of time to work with IUGR, unfortunately.
Do you treat the same ailment not getting relief with allopathic
Yes,
drugs?
yes, yes. So morning sickness, definitely. So the maximum that I have treated so far is nausea, vomiting, and they are already on Ondem twice a day. They are on domperidone sometimes, and all these things, and still their nausea is never gone. So I treat them with the medications. I tell them, if you are better, you taper down the medicines, and they themselves do it.
And this everyone usually asks, do you tell the patients to stop allopathic medicine?
No, no, I don't tell them to stop immediately, because I think I tell them first you see how much you're improving with the homeopathic treatment, and then you decide, or talk to your doctor and let them taper it down. So it's
Yeah,
very dangerous to directly tell them to stop it, because in case your remedy is not right, in case you need a second prescription, then it affects the mom a lot. So directly don't tell them to stop medications unless you're very, 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 very sure of your remedy.
true. When you use supplements like iron and calcium along with tissue salt, how to judge?
Uh, it's a good question. It's a little
Start.
difficult to judge. The reason why I give ferrum for iron, improving iron so confidently, is because I've used it without supplements in a lot of mothers, and it has helped. So, which is why I give it directly, and I know that it helps. But with the supplements, it is kind of difficult to judge. But if the iron HB is not low, so it's above 11, I would say above 11.5, and if the mother is, a lot of the times the mothers only say that I want to stop the supplements because I'm getting constipation because of it. And if the mother wants to stop it, then you can tell her, you know what, 1 month you stop it, we'll give you this, see how things are going. Usually in 1 month's time, her hemoglobins would have gone up levels. So
Gone up,
then you
yeah.
know. Yeah.
Uh, Prarthana has asked, any contradicted medicine pregnancy?
Nothing really. If the totality fits, then you can give whatever remedy is indicated. But then, as I said, it has to be fitting the totality. Don't do blind prescription. That's all I tell. Don't do blind prescription, because, as I said, suddenly, let's say you're giving a mother colophyllum for something in her 28th week, it might trigger some contractions. So
Yeah.
just make sure that you're giving the remedy for the right thing.
Do you treat postpartum depression?
Oh, yes, definitely. Postpartum depression, I think it forms a huge topic in itself for treating in homeopathy.
Yes.
And definitely a lot of help with anxiety, with suicidal thoughts, with, not feeling bonded, attached to the baby. But there are a lot of different aspects of postpartum depression. There is family support, there is breastfeeding issues, other physical pain and other issues post the delivery. So you need to address all these things when you're dealing with postpartum depression.
Can calcarea for 6s be given along with calcium
Yes,
supplements?
definitely. And I would suggest stopping the calcium supplements and giving only calcarea for 6x, because I think calcium supplements do a lot of damage. And they are given blindly without even doing a blood test to see if the mother needs them. So I would suggest just give them calcarea first, because that will balance the metabolism. Like, it will improve absorption if it is needed, and it will not absorb if it is not needed. So it's very safe that way.
Oligomenorrhea, what homeopathic
Ah.
medicine to use?
Constitutional totality. There is no one medicine for oligomenorrhea or for any problem for that matter in homeopathy.
True, very true, very true.
Yeah.
Gestational diabetes, yes. Coming to this part, I think we can talk about it right now because it's time. She has given. We actually wanted to have the whole webinar only to introduce you attendees to inform that we can practice homeopathy during the gestational period, during the obstetric period. Uh, we have Dr. Shruti has planned a detailed course, a series or a workshop like for 4 sessions or 5 sessions, Doctor
Four
Nirvana?
sessions. Four
Four
sessions.
sessions.
Yeah.
She is in detail, in depth. getting in depth with all each and every topic during these 4 sessions. So everything, including gestational diabetes, postpartum depression, or during labor, everything would be covered in those 4 sessions. And yes, doctor, you can explain if you have anything else to
No, no, no,
want to
you are
say.
doing fine. Yeah, so this is what we'll be doing because as somebody asked about gestational diabetes, is a big topic in
Yes,
itself. Definitely, it can be, controlled with homeopathy, but there are different aspects to it. There's diet, there's exercise, eating patterns, all that thing also needs to be addressed. So,
true.
yeah.
Be it eclampsia, gestational
Hmm.
diabetes, everything. I think she's.
Yeah.
I am eagerly waiting for the 4 sessions because it's going to be a big, huge learning opportunity for everyone. I am also sharing a poll. If if you're able to, I'm sorry, the Facebook viewers won't be able to attend the poll, but the Zoom participants, if you're able to attend the poll, please do attend the poll so that we will know how many of you are all interested in actually coming forward and taking part in the workshop. It will be a great success for us also that we have reached so many people and so many people have.
Yeah,
Ma'am,
and
can you
also, I mean, slowly, I'm also connecting with, as I said, with a birth center in Germany,
yeah,
with other doctors. So I'm getting data in from them also. So what
yeah,
sort of remedies they are using in labor? It's quite interesting to see their case notes, see how it has helped. And so I think I'll be happy to share those things also.
true. Ma'am, can you share fixed regimen of tissue salts? Please share. I'm
Yeah,
interested.
I'll
Like,
share it with you, Rashmika, and then you can
yes,
see like how you
sure.
want to give it to them.
Definitely.
Yeah, we can do
Definitely,
that.
definitely.
Yeah.
Monica, which brand of medicines do you use?
As
Okay,
a
that will
normal,
come.
yeah, any brand, SBL is there, there's Nelson sometimes, then St. George, whatever brand, I don't think it matters much.
Yeah,
I'm sorry, I don't have a fixed brand as of now. I think
yeah,
SBL only majority I use.
that's absolutely fine. I'm going to keep the poll open for another few minutes. So if you're interested, please add to your poll so that I'm interested in the workshop. Thank you so much, Manisha. Thank you so much. Regarding the workshop, we will get back to you on when the workshop will be. Yes, the workshop details. Yes, Ritu. Hi, Ritu. The workshop details. We, uh, I give us a little short while since we work out on the web page, the payment link, and all the posters and everything. You'll be seeing the posters and all the payment link. If you're in the WhatsApp group, we will be sending it in the WhatsApp group. If you're a email registrant, we will be sending it via email. We'll obviously be posting it on our Facebook and Instagram platforms. Yes, I will share the WhatsApp link if anyone wants to join our WhatsApp link for updates. Um, I will share the WhatsApp invite so that you can join the WhatsApp page. If not, if you're not interested in WhatsApp, I will also share the link for registration where you can. Um, 1 second, I'm just copying the invite link. Yes. This is the WhatsApp invite link. This is the WhatsApp link where you can join WhatsApp group via this link. There is another pahola.la/register where if you're not interested to have your WhatsApp updates, you can register with the www.bahola.la/register, where I will be sending you email updates or email notifications where when before the webinar you can join or before the session you will have an update on it as well. So I shall I end the poll? Is it fine? Thank you so much. Majority of you have said that you are interested in joining the poll. In joining the session. It's lovely to know. I hope you all join the session. It will be a great success for us also, and it will be a great.
Yeah, and thank you so much for joining in. I'll keep the sessions more interactive because I like it that way. So there'll be
Yes,
few people, so we can have some question answer time, and I'm going to ask some questions, and you can guess the remedy and those kind of things. I think that will be more fun. Yeah,
Yes, it's going to be lovely, and I'm eagerly waiting for the sessions also, Doctor. Hopefully, we will plan and we will let you know all
sure.
when the sessions will be held, and according to her schedule and I Love Homeopathy schedule, we shall plan and go ahead. Thank
Sure.
you all. Thank you
Awesome.
so much,
Thank
Doctor,
you.
for joining. Thank you so much for giving us this webinar. It's been a lovely chat. Sure, ma'am. Go with the questions. Patricia is always energetic for questions. She's always craving for questions. All webinars, she'll be like, "No, ma'am, forget the webinars. Just ask the questions and we'll answer you." Thank you so much for such an interactive participation, Ritu. Thank you so
Chalo.
much, Doctor. It was lovely
Chalo.
talking to you. It's
Welcome.
always been lovely.
Chalo. Bye.
I wanted to ask you something.
Huh.
What have okay, okay.
Sure, sure. Tell
No,
me,
no,
tell
no.
me.
Have you attended the Palghar MLW's college also, where
No,
they also
no.
do?
I know, I know. The thing is because I didn't do BHMS here, so I never got a chance to do that. So if there is anybody who has
Got it,
done
got it.
that and who would want to connect with me, please feel free to
Yes, it should
take
be
my number from
lovely.
Rashmika and get in touch with me, because I would love to know like how things are, because I did hear that Palghar has homeopaths working in the
I would
neighborhood.
love to know. I would love to join. The only reason I couldn't join was, I wanted to stay back in my hometown and I didn't want to travel now. But I would have,
I no
given
no tie
everything
up
to
with
join
the
over
tie
there.
up with an obstetrician over there, tie up with a gynecologist over there, and go work in the labor ward. That
Yeah.
is the best way, to get
Ah,
experience
true.
in this
Very
field.
true, very true.
Yeah,
I think they also do a lovely job, and I thought you would have had a connection, so I thought I'd ask you about it.
unfortunately, no.
That's not a problem at all. Hope and if someone of
Chalo.
the chat part would definitely connect with us
Sure,
now.
sure.
Hopefully,
All
yes.
right.
Thank you so much. Have a good
Thank
evening,
you.
everyone.
You
Have a good
too.
evening.
Bye
Good
bye.
night. Ritu, MD in Gynec is not available for homeopath. It is
No.
available. That is the Palgar. This thing they do give.
No, but I don't think it's a field in itself. They don't have
Not a
MD
field in itself.
specialization in gynec and
Yes.
obstetrics, which I think they should have. So,
Yes, I think people are coming up. Like I attended Dr. Adil's summer school last year, where he spoke a lot about cardiology in his homeopathic practice. There are
hmm,
so many people coming up like that, psychiatry in homeopathic practice, or
hmm, hmm, hmm.
obstetrics in homeopathic practice. That's such a lovely thing, when you know that your
Yeah.
panel gets wider day by day. Anyways, I let's not further
So,
this thing. You have work. I'll also.
yes, bye bye.
Thank you so
Good
much. Good
evening.
evening. Good
Thank
night.
you. Bye.